So as you have seen that the swelling is globular and in some parts it's irregular also, but mainly globular. Next, after seeing the shape, we have to measure the size with a tape, and we have to measure in two directions at least. So first let's measure the transverse and then we'll measure the vertical. So let's start the transverse with that tape that we have. So we start from the maximum diameter. Suppose this seems the maximum diameter area, and then transversely you have to go to the below. So okay, this seems about 40 centimeters transversely, and then we have to measure vertically. So from the topmost part of the swelling, topmost part of the swelling and the lowermost part of the swelling, this is the vertical. So it's about 21, 22. So this is swelling of about 40 over 22 centimeters in size. Next, we will actually start the palpation. So the size, measuring the size of the swelling is actually can be done in both in inspection and palpation. So don't confuse with them, because I didn't touch the swelling actually with my hands. So size measurement can be done in inspection also. No big deal. Next, we can actually see the surface of the swelling. So the most two important things that we need to see is there any features of inflammation, and are there any engorged veins. So as you can see, this swelling, in this swelling doesn't have any features of inflammation, but here we have some engorged veins here. There are some engorged veins here, and there are no other features. And now we have to actually compare this limb with the opposite limb. Okay, so please let me there. So you can see here there are some engorged veins here. Actually, maybe this swelling compressed the veins of the upper limb, suppose subclavian vein or axillary vein, and that's why the veins of the upper limbs are engorged. Okay, so we can actually compare. We have to compare this limb with that limb, and you can see the compression actually resulted in a larger swelling of the veins in left upper limb. Okay, so this is an important finding that you might want to look at. And then we have to start the real palpation, and before starting the real palpation, we have to assess the temperature of the swelling. Suppose we have to assess the normal side first, and then we have to assess the abnormal side. So we see the temperature here and here, and it seems the temperature of the swelling is more than the normal side. Then we ask the patient if there is any pain. চাচা আপনার কি ব্যথা খুব বেশি এখানে? আচ্ছা, তাহলে আমরা অল্প চাপ দিব, জাস্ট দেখবো যে কেমন ব্যথাটা, হ্যাঁ, অল্প একটু চাপ দিব. So we look for tenderness. So the swelling is tender, very tender. Next, we have to see the surface. So we are seeing the surface. So surface is irregular. Then we have to see the consistency. So the swelling is tender, very tender. It's hard. It's a very hard swelling. And then we have to see the margins. The margins are well delineated in the lower part, but not well demarcated in the upper parts, upper chest, and also not well demarcated in the upper back. Okay. Then we have to see the fixity. So we have to see the fixity overlying skin. So it seems fixed to the overlying skin. This may misguide someone because it may not be fixed, because the skin over here is actually stressed a lot by the tumor. So that's why the skin seems fixed. Okay, so we are not actually sure that if it's fixed or not. Next, we have to see fixity underlying structure, especially fixity underlying muscle. And here we have two muscles. In the front we have the pectoralis major, and in the lateral side we have the serratus anterior. So we have to see the fixity by tauting the muscle, or actually making the muscle contract. আচ্ছা, আপনি আমার হাতে ধরেন, হাত ধরে আমার এইদিকে চাপ দেন, এইদিকে, হ্যাঁ, very good. So we have to move the swelling along the fibers of the pectoralis major, and then we have to see also the serratus anterior. আমার হাত ধরেন চাচা, হাতে ধাক্কা দেন, আপনি ধাক্কা দেন হাতে, Doctor then? It's okay. So it seems fixed. The swelling seems fixed with the pectoralis major and cervicocentral muscle. And after seeing fixity, so we have completed the most important parts of the examination. Then we have to also see the lymph nodes of the axilla and also some cervical lymph nodes. And we actually have to examine patient's chest and do the general examination also, and examine other systems if there is any features of any invasion or something like that. So those will be the most important parts that one need to do in an examination of a swelling. Thanks for watching the video, and also remember that in type of spatial swellings we do spatial tests. Suppose someone has a cystic swelling, and if someone has cystic swelling, you have to do two spatial tests. So you have to do a fluctuation, and also you have to do cross-elimination. And if someone has swelling which arises from vascular, so if the swelling is pulsatile, you may need to do a compressibility test. So in case of hemangioma, it will be compressible. And if the swelling arises from a body cavity like chest wall, so like abdomen, you may need to do a reducibility test if the swelling is reducible or not. Okay, so those are the most important things that you have to see. And thanks for watching the video, and thanks to our patient also. আচ্ছা আপনাকে ধন্যবাদ, অনেক কষ্ট করছেন।